Hi guys. My name is Natalie Mireles. I chose the endocrine system for the body system project. The endocrine system is a system of glands. Each gland secretes different types of hormones directly into the blood system. So to maintain a homeostasis. I'm pretty much going off my notes here to speak to you guys about this, and I'll probably go kind of say my own thing here and there. But keeping the body, the homeostasis, as you can see, is a constant and control. So basically keeping the body in a constant and controlled state. I'm going to go into a little bit more detail. This is a diagram of each of the different types of glands that the endocrine system has. So pretty much it's the pituitary gland, pineal gland, thyroid gland, parathyroid gland, thymus, pancreas, adrenal glands, and the gonads. There are 13 major glands. The pituitary gland is the master gland. It's attached to the hypothalamus. The hypothalamus regulates the pituitary gland, obviously. It connects the anterior pituitary portal of bloodstream, connects the posterior pituitary to the neuronal connection. Forgive me if I don't pronounce some of these words correctly or if I'm kind of there. So the hypothalamus, from what I've noticed, is maintaining the core body temperature with normal levels. The pituitary gland, pretty much what it does, it helps, it produces hormones essential for processing growth, development, metabolism, sexual function, muscle, and bone mass, and maintaining our blood pressure. So the pineal gland, production and secretion of melatonin. So melatonin, what do we use melatonin for? It's our sleep hormone. So lucky us, we develop melatonin, but there are obviously some of us that require more melatonin. For example, me. And I think I seen someone else on one of the videos that she also takes melatonin stuff. Sorry. To help us sleep. Sometimes we have a little harder time sleeping. So then there's a thyroid gland. Thyroid gland regulates our metabolism and calcium level, and it makes the T3, T4 hormones. Pretty much as you can see from this diagram, T3 and T4 increase metabolism, growth, and development. Now there are the 4 parathyroid glands. So thyroids, there's four little glands right here. What they secrete the PTH, which is a parathyroid hormone. This hormone helps the bones release calcium, helps the kidneys reduce calcium, and helps the intestines activate the vitamin D and helps them absorb the calcium in the gut better. Then the thymus gland. This helps with the immune system. This development of the immune system helps the immune system develop antibodies. It secretes a hormone, thymosin, which the changes lymphocytes into T lymphocytes, T cells, which play an important role in the immune response. Pancreas, pancreatic ileus. So 2 major functions. Endocrine function that helps in the digestive system. It helps us produce insulin, glucagon via somatosting. As you can see, I'm gonna go into a little bit more detail about the pancreas in a minute. Then there's the 2 adrenal glands. Helps with metabolism too, the balance of salt and body in the water in the body, the immune system, and the sexual function. There are the inner part or adrenal medulla produces hormones. These hormones help the body cope with physical and emotional stress by increasing the heart rate and blood pressure. I think that's something we could call a fight or flight. Then there's the 2 gonads, reproductive system. The ovaries produce progesterone. They also produce estrogen. And then the male's testes, they produce testosterone. But pretty much what each of these hormones do is help, though, give the male and female their characteristics. Okay, so for my health thing, I chose diabetes disease. I chose diabetes mellitus, type 1 diabetes specifically. The reason why I chose this was because my husband is diagnosed with type 1 diabetes. He's had it for 20 years already now. He's going on 20 years. This is an autoimmune insulin deficiency disorder caused by the destruction of the pancreatic beta cells. Insulin deficiency means that the pancreatic beta cells do not secrete enough insulin. They're different symptoms. Urination, that's what happened. He ended up figuring out, oh, why am I peeing in the bed so long? So that's what ended up happening. When he peed in the bed, he was thirsty. He ended up finding out that he has vitiligo. So usually what diabetes comes with is another skin condition. He ended up having vitiligo. So a lot of these symptoms right here that happen on this diagram are usually due to when he's high, which is glycemia, which is when he goes through that, he usually feels tingly hands. He will feel weakness. He'll feel hungry, but he feels just mostly super tired. When he's hyperglycemic, he feels nauseous. He feels a really bad cramping sensation in his body, and he's super thirsty. And because he's thirsty, it causes a lot of peeing sometimes. So a lot of these symptoms right here are still going on. It's not because those were the only symptoms. No, it's because of what he's going through still when he goes through those certain diagnoses. The health professionals that he has to deal with usually is his endocrinologist, which can be difficult to find a good one here in the Valley. He also needs a diabetes educator. Kind of gave up on using those most of the time, only because a lot of diabetes educators now are not really as educated in the type 1 industry. From what he's noticed. Maybe there's someone else out there good. Medical procedures that was used to diagnose: fasting blood sugar tests, oral glucose tolerance tests, home glucose monitoring, random blood glucose testing, and then the A1C testing, which he gets every 3 months. So it's not just diagnosing. The A1C one keeps him figuring out the average number, which is the goal is to keep him below 7%. Medical equipment that he needs is an insulin pump, syringes for insulin injections, which you can do both. There's 2 different types. Then there's a CGM, continuous glucose machine. This is recommended. It helps keep your blood sugars, glucose numbers, keep track of them. But there's also the blood glucose test strips, which is what you would be normally, you'd poke yourself and then you'd inject yourself. You'd figure out your blood. So the different illnesses and diseases possibility that he can have is ketosis process. The body utilizes stored fat when other sources of energy are lacking. An excess of high level ketosis may indicate that the body is not producing enough insulin to convert glucose into energy. Cardiovascular disease. So due to his high blood sugars, he can get a heart attack. He can get a stroke. His arteries can get clogged. Nerve damage, high blood sugars and low blood sugars. It's mostly high blood sugars that can cause this. He'll end up losing feeling in his legs. That's why they say feet usually he'll lose feeling in his feet. Sorry if I'm getting a little emotional right now. There's kidney damage. Kidneys contain tiny blood vessels, clusters that filter waste from your blood. Diabetes can damage this delicate filtering system. Severe damage can lead to kidney failure, irreversible kidney disease, and they may end up being on dialysis or a kidney transplant. Eye damage. Diabetic retinopathy, potentially leading to blindness. He has really bad eyesight as it is. He has a stigma in his eye, but I feel So a lot of these things can happen. Foot damage, which is the nerve issues. Skin conditions. He has vitiligo. Again, that is when the color of our skin pigmentation is slowly going. He does get fungal infections very easily in his feet. Hearing impairment, he has a hard time hearing here and there, but he's pretty good. Depression is more because of the management, and he is something that he suffers from that. So the different body systems that are affected are the cardiovascular, nervous, urinary, respiratory, immune system. I say special senses is, I know it's not a body system, but I say because his ears and his eyes can be affected severely, and the integumentary system, which is the skin. Things that are he needs to eat healthier food, he needs to be physically active. It's important to keep his weight low as well. That helps. And here are my references I use to figure all this out. And that is the end. So I'm pretty sure I went over the time limit, but I just want to say, you guys, diabetes, it can be very difficult. I feel this topic was very important to just show to others that it's not just, I guess a lot of people would, say to my husband sometimes, oh, you have a fat person disease. That's not what it is. It's many different reasons. He's, we're type 1, type 2, you could be the skinniest person, and for type 2, and you could be diagnosed with type 2 diabetes, which, it's just very unhealthy eating that could cause that, or it could be running in the family. Type 1 diabetes is insulin dependent, so he got it when he was 10. How can you say he was a fat? Does that make sense? If that makes sense to some people. I'm pretty sure I went over the time limit again. I just wanted to really share some of this because it's important to me, I guess, in the sense. Thank you and goodbye.